we found this fella on the street who was asking for some help with his pain. He had a very large abscess on his face. He's, of course, very nervous to be in any sort of facility or be kidnapped, anything like that. But he has a lot of pain, so our goal is to get him into a hospital. He has a large abscess, he needs to be into a hospital. But we sort of need to strike a bargain with him with other things that he wants to get him into the hospital. He may not be thinking completely logically. So he wants to get a shower and new clothes, so we're going to take him to the Ocean Park Community Center to kind of work with what he wants to get our overall goal accomplished, which is get him to the emergency room.
Do we know his identity?
He gave us a name, but we don't know if that's a real name or identity, and he was not able to come up with a date of birth, so it may be very hard to identify him.
Would you like to come with us in the van? Because we can take you to where the showers and the clothes are.
What's the name of this place?
It's called OPCC. Have you heard of it? OPCC is the access center where you can get some food and some clothes and a shower.
Well, is it far from here?
No, it's very close.
How far?
Well, we have a
How
van.
close is it?
We have you there, and then we can take you to the doctors. If he doesn't allow us to treat him for this infection, I think he could die from this infection. Most likely, it's just a large abscess, which is a collection of pus. We saw it was oozing. There was a lot of dead tissue around it. I also worry that it could be cancer or tuberculosis. Again, without treatment, is deadly. But just the infection alone, if that doesn't get treated, he could develop what's called sepsis, where the infection's in your bloodstream and you die from it.
I think it's a spider bite because it swelled up in one day. Bad. From here to here, it hurts really bad.
So how long did your petty die?
Like 2 days. For 2 days. I've seen the doctor before when I had a really bad cough, remember? And the antibiotics that you gave me helped. They took it away.
So we saw Ida a couple weeks ago.
Yeah.
We treated her for a cough, but she was complaining of an infection in her arm here. So
I don't know. It's like really bad swollen.
probably the most prevalent contagious disease that they get infections with is with a normal skin bacteria that we all have. It's just that they are not in an environment that they get their skin washed or protect their skin the way we do. So they get a lot more little cuts. They're using drugs, so they're putting needles in their skin. So they get a lot of infections with very common bacteria. So those bacteria would not affect us because we're probably not going to be exposed to the environment that they're exposed to. These bacteria have become resistant and make a lot of news stories, but they're still very common bacteria that most of us probably have living on our skin anyway. So we're really not too afraid of getting exposed to their contagious disease because we're taking care of our skin.
I'm riding my bicycle and something come out of the wind and hit me right in the eye.
When did this happen?
No, year I was in Harbor General for 9 months, and this year I had cataracts, so I put an implant in this one.
Usually, you see them for kind of minimal reasons, but upon further questioning you can kind of dig up some more chronic issues that might need a little bit more intense medical care. So we really try to encourage them to go to the clinic. If they're really ill, we'll bring them to the clinic. I've taken a couple people to the emergency room as well. So, but yeah, sometimes if you can find the little things that are bothering them, like toe itch or aches and pains, and then ask them if they have other things going on. You might be able to uncover some more chronic and potential life-threatening illnesses. So that's another reason why we're out here, so that we can get them to the clinic or get them the care that they need before it's too late.
Yeah, I had brown eyes. They put a green implant in this one. Yeah, I want to get a blood test and the whole 9 yards, so I'll probably do it tomorrow.
Susan, I'll go ahead. Those guys are right there.
Yeah,
We're ready to pick up the car.
Okay, sounds good.
Okay.
Shower.
Jose, how long have you been on the streets for?
For about 4 months.
4 months.
Or 3.
Okay. Okay, we'll take you to the Access Center, okay?
Access even.
Yeah, but
Yeah.
we're
It's
talking
7
about-
blocks, right?
Yeah, but we're gonna give you a ride.
Okay.
Yeah, that looks pretty painful. Okay, so let's get you in the van. Okay, come on.
Come with me.
Hello, sweetheart. How are you?
Okay.
Yeah, she's okay. We see her every week. We've got to take this medicine.
Y'all just don't want to admit that I'm a doctor. I've been here since 1979 on and off. I got all my schooling in New York City, and I practiced in Emory University in Atlanta, Georgia.
C? Okay, what's the next letter?
Wednesday, Thursday, and Saturday.
U. C-U. Your last name.
How do you pronounce that, Jose?
What, the itching?
But sometimes, you know, that's why I sleep with myself. You know, I don't like staying in the missions.
Okay.
And sometimes even if you know you don't need to go to psychiatry or other things, you know, sometimes you need a letter in order not to reach in jail, you know, to be seen by a medical commission with no reasons, you know.
Or just to have someone to talk to.
Yeah, you know, I think I talk to a lot of people.
That's the best way is to get your blood pressure treated. The best way is to get you into our clinic, okay?
Yeah, I know. I hate that.
So hopefully you can make it over there.
I'll try it. I
You can
can't
do a
promise
few more
you.
testing. No, I don't want any promises. Just
I know.
that's
I know.
what I
I know.
recommend to you.
Nothing to worry about. I
If
mean,
there's anything else I can help you out with today, but your blood pressure is high. It's not dangerously high right now.
no, thank God for that.
So, if you have any chest pains, get yourself on over to the emergency room, okay?
Okay.
All right, Johnny.
Okay.
All right.
All right, thanks, sir.
Yeah, Thursday.
Yeah, so you went
Finally, I had to go to the hospital about it.
I've been hanging in there. I got down in a way. I got over that medical family health.
I want to see my friends.
And I think what not just being homeless, but I think what complicates the situation the most is his mental illness issue, and just not really trusting other people, not really understanding the need to take care of this. And I think that's probably the largest issue that we deal with, is dealing with the mental illness aspects of everyone's. If they have any other illnesses, it's dealing with the mental illness problem first, to really get them to understand how important it is to take care of their health. But you want to treat the mental illness part too, which they're usually not agreeable to that. Often they don't think they have a mental illness issue, so it's hard.
I work in the Venice Family Clinic seeing similar patients in an office setting, but they're much higher functioning patients who are able to actually make it into a medical office.
I see. And what are the most common ailments here on the streets?
You see a lot of people with a cough, because they've been out in the environment, even though it's much milder and violent environment in California. But you're going to see people who are complaining that they have a cough that they can't get rid of, so they're unable to sleep in a warm place at night. So that's a pretty common complaint.
Tuberculosis is something that we see more in developing countries, but in the United States, we see it more in homeless population, and Los Angeles having the highest homeless population. It's pretty prevalent in Los Angeles compared to the rest of the country. And there's actually public health is very stringent in finding people who have tuberculosis and making sure they're treated.
Have you found any?
Yes.
And what do you do when you find a case of TB?
When you send them to the emergency room to be hospitalized. But it also depends on if they're coughing. If someone has tuberculosis and they're coughing, they're very contagious. But if they have tuberculosis and they're not coughing, they're not contagious. So it's really up to the physician in the emergency room or at the hospital to decide if they're going to hospitalize someone who has tuberculosis. But usually if someone's coughing, they'll hospitalize them until they've had some antibiotics enough to where they're not contagious anymore.
There's a lot of people out there in great need of medical attention that don't have the ability to either transport themselves to the Venice Family Clinic, or a lot of people, and you'll see this, have a lot of foot and leg problems from being on the streets and having to walk so much that they're not able to get themselves to the Venice Family Clinic. So we take what we call street medicine to them, and it has been a great success.
I came here in 1984, and well, I didn't speak English at all. I was just a tourist, and then I decided to stay. But all of a sudden, one day, my son got sick in the park, and a lady told me about the clinic. I didn't know about this clinic, but I found something very good because people was speaking my own language, and they treated me so nice. So we became patients. And then after being patients, I decided to volunteer. That was 23 years ago, and now I'm a staff for almost 11 or 12 years.
Tell me about the patients here.
Okay.
What kind of patients do you have?
Well, we see patients from all backgrounds, from different ethnicities. We see children, adults, homeless patients, and they come with all kind of as I said, backgrounds. They're ill, they have no house, they don't speak English, some of them. So it's a very interesting place to work at.
Are your patients very sick when they come here?
No, that's usually not. We're not an emergency room. It's not like, with some exceptions but they're actually pretty sick as far as chronic diseases go.
Monday, Thursdays, and Fridays.
The majority of our contributors, even though they are famous in Hollywood, they do not need any kind of publicity. They do not seek it out, and we're very grateful to their contributions. Over a third of our budget comes from private individuals. One of our donors, Larry King, makes it possible for a patient of ours, any patient with a serious heart problem, can go to Cedars-Sinai Hospital and receive the most complicated, delicate surgery at no cost, thanks to Larry King.
We are running here for many years a program of rehabilitation of torture victims. People who come to the United States from different countries have been tortured in their countries, and then we do the rehabilitation of them and trying to get political asylum. When we began around almost 26 years ago, most of our victims came from Latin America, especially Central America or South America and Chile, Argentina. But in this moment, most of them, around 50–60%, are coming from Africa.
He's currently in the shower. We've just got him some clothing. We're going to have security keep an eye on him. And when he's finished, he will give us a call. He won't let him out of his sight, so we can transport him to the hospital.
You're going to take him to the hospital?
Yes, in this van. No, in the van. We're going to go to the hospital. Okay, I'm going to get that for you. He's oozing a little. Okay, I'm going to get him a jacket.
Can you get some tissue?
Yeah.
Okay. Hey, Jose.
We some card coffee.
Okay. Did you feel better after your shower? Yeah? Okay. So remember we talked about going to see some doctors for your neck?
What about my neck?
What about your neck or your jaw, I mean? You've got this big infection on your jaw. And I bet I don't know, but you definitely need some medicine for it, yeah?
All right.
Okay. So
what for? The medicine.
The medicine for the infection.
Oh yeah.
You up for that?
Yeah.
Okay. And if they want you to stay in the hospital, how would you feel about that? Because they would give you some. You would get
I don't know where to go.
Exactly. They give you a clean place to stay. Okay. Yeah, they give your back is hurting. Okay.
I give a massage.
Okay.
What do you give you a massage?
That's not in my job description.
Yeah.
Okay.
But the thing is, you know, nowadays everybody should realize it's either you are in big trouble, you know, and it's not your fault. It's either you run away, you take the chance because you know that they might come after you, but they might come home. The situation is so bad, you know. And sitting in the street is saying, oh my God, what
Lean your head to the side.
In time, even after years, in the city, seeing somebody like that one, it's like the grave. I'll be back right here. It's like it's excellent.
Just to kind of
like very personal memory on the side of the Yeah, what happens if you drink a quart like now?
Get in the van. Probably laid him on the floor and knocked him.
You're cold?
What hurt? On the floor.
You got the flu?
You said you better be at what hospital?
We're in Santa Monica Hospital.
Okay.
Where they have really nice doctors there.
10 blocks.
Yeah, 10 blocks.
They let you smoke?
They'll let you smoke, not right away, but once you get settled, then you can smoke your cigarette.
Stay there.
Well, it depends on the doctors, but I'm hoping that they'll let you stay there a few days so that they can get some medicine in you so that the infection can get better.
I thought you said medicine only for the infection.
Yep, that's what I'm saying. Medicine for the infection and maybe even for pain.
Okay.
Okay?
Yes. And I have to come back over here. Or where do I go?
When you're done with the hospital, yeah, you can come back to the access center.
The blanket?
Well, we just gave you a blanket right here.
The one that brings too much. Ah, this is here.
This is where we're gonna walk in through those doors and sit in the waiting room. Okay?
Oh, but you gotta wait.
No, you won't have to wait too long. It's not that bad here.
All right, here we go. Let's help you out of there, buddy.
You have your black guy?
Yeah, he's got it.
What do we do over there? They don't let us smoke. Come on, Jose.
So I told you when we get you in there, we're going to get you some good medicine for your pain, okay?
Yeah.
And that's the main thing. We get your pain treated and then they'll get that fixed up, okay?
I mean, just the medicine, I hope it don't take too long.
It won't take too long.
Right.
Susie's going to be with you in there, okay?
I don't like to be, I like to make sure.
All right, Jose, here's your coffee.
Oh, she's got you coffee too, man.
Susie bought you some coffee, okay? It's going to be just fine, okay? Here we go.
You might want to tell him that.
What's that, Susie?
That has cream and sugar in it.
This is the waiting room. See, it's not too big. It'll be just fine. We saw a lot of very common things that were very inconsequential, and we saw a guy that was potentially very sick, and we had to do the best we could to try to talk him into going into the hospital and get that infection in his face treated. So we had to coerce him a little bit with the cigarette out front, and we finally got him in there, and who knows if he will stay, but we hope that he'll stay in there and get treated.
You see these homeless people on weekly basis.
Mm-hmm. We see them in the clinic as well. But these are probably the sicker of this sex.
Is there something big that should be done?
Like dealing with mental illness on a big, grander scale, I would think. And also, when you talk about homelessness, probably the most important thing is getting them housing. But a lot of times when you're dealing with mental illness, even if there's housing available, it's hard for them to accept the housing if that's available. So I would think that if there's a big cure for everything that we've been seeing, that we'd have more aggressive mental health care. you.